Hello, Michigan. We are live and we'll be starting our presentation in about 1 minute. If you are watching this after we have done our live presentation, if you're watching the video of it afterwards, if you have any questions, please contact the HCMA office. My contact information is available on this slide, and we will begin in just about a minute. So it's a rainy day here in New Jersey. What's the weather like in Michigan today?
We have snow flurries, and it's 22 degrees, and it was 72 degrees yesterday.
Oh, okay. So we're going to be like 67 degrees today, and we're going to be really cold tomorrow. So
I
we're
think so. I
we're
think
a
it's
day off
coming.
of your weather
Yeah.
coming from the west. Okay. So we'll give it another couple of seconds here, and we will get started. Do, 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 do. All right. So we are ready, set, and it is 1:30 Eastern Time, and we are joining you from New Jersey and Michigan, Grand Rapids, and we're going to talk to you today about what HCMA is, what HCM is. We're going to show you your state report card, and we're going to tell you a couple of stories, and we're going to hope that we get you interested in wanting to learn more about how to find families with genetic heart disease and how we can hope to help keep these families whole in the future. The HCMA was founded in 1996. I am the founder, and I lost many family members to HCM. And based on these losses, we wanted to create an organization where we could focus on the needs of the families affected, help develop the care models for those with HCM, and really advocate on behalf of this patient population. And we have expanded that to kind of include all genetic heart disease. So it is our goal to be the best as the best we can be at providing these services to these patients. And we're going to tell you a little bit about how we get that done in the next couple of slides. One of our major programs is called the HCMA Recognized Center of Excellence program. And the state of Michigan has two centers that we recognize. One is Corewell Health, and Dr. David Furman is one of the directors of that program. And our other partners are over at the University of Michigan. And you can see that there's some pictures of yours truly standing in front of your state house last fall, where I got to meet a number of you. And we're hoping to continue the conversation and make sure that we're providing all of the services to the people of Michigan to ensure that we're keeping their hearts safe and happy and cared for. And now I'm going to introduce Dr. David Furman, who's going to tell you a little bit about HCM. Good morning or good afternoon, David.
Good afternoon. Yeah, thank you, Lisa. So here at Corewell, formerly Spectrum, we've been working with the HCMA the last several years to build our program to take care of patients with hypertrophic cardiomyopathy. So HCM is a disease that affects the heart muscle primarily. And as you'll see on the next slide, it can cause a number of serious health conditions. The process in HCM is that the heart muscle thickens abnormally, and this can cause the heart to become stiffer. It can leave less room for blood to fill the heart or for blood to flow out of the heart. And I like to say that this is either a common rare disorder or one of the most uncommonly common uh, heart disorders that people may or may not have heard of. It's felt that the prevalence of this as the most common inherited cardiovascular disorder is about 1 in 250 people. So that in the United States alone, 1.3 million people may be affected by HCM. And in Michigan, where we have, based on the last census, almost exactly 10 million people, that would be potentially up to 40,000 individuals in Michigan affected by HCM. Around the country, about 150,000 are currently diagnosed. So you can see that there's a huge, potentially undiagnosed population. And since this is a genetic disorder, uh, a lot of these may be families that could be affected and at risk. The biggest risk that people often hear of publicly is the risk of sudden death. Since HCM is the most common cause of sudden death in young people, this is most visible when when we see young people, often athletes, collapsing, often this is attributed to HCM. But in reality, the spectrum of HCM disease goes across from young to old, and across a huge spectrum of clinical variation. And by what that mean by w- that I mean on this slide, there are many different heart conditions or syndromes that HCM can lead to. So on the left, we talked about sudden cardiac death, where there may be no symptoms that this person has before they collapse. Hopefully, fortunately, might be resuscitated, and Lisa will talk a little bit about that later, um, and be treated with an implantable defibrillator. There are other problems that I mentioned. The thickness of the heart can cause heart failure, progressive heart failure symptoms, which need to be treated. Often we use like standard heart medications that are used for other heart conditions. But what's been really exciting and good for our patients in this field is that the first drugs that are specifically designed for the heart muscle problem of HCM, uh, first drug was approved last year, and there are more, actually 2 years ago now,
Yes.
since it's
Yeah.
2024, and there are more on the way. And so that's a really encouraging time for our patients. HCM can also cause uh, electrical problems in the heart arrhythmias like atrial fibrillation, which is itself one of the most common heart problems that people develop with age in this country. And that raises the risk of stroke because of blood clots that can form in the heart. And in our HCM patients, this is a common complication that maybe need to be treated with additional drugs, blood thinners, other procedures or devices like pacemakers. And so HCM patients present from a variety of ages and a variety of symptoms. And I think Lisa will talk next about where we are in Michigan with HCM awareness and treatment.
Fantastic. Thank you very much. So, we have created at the HCMA a new state report card. So, we know some of you legislative types like to be a little competitive and see where you stack up to your other legislative partners in other states. So, we've provided that opportunity for you. And the good news is, Michigan, you're doing okay in some things. We've got some other areas where we could do a little bit more work. So thank you very much to the state legislature for recognizing HCM Awareness Day. And I was there to get the proclamation. Actually, it's sitting right behind me here. And we really appreciate that proclamation. You have some AED placement laws, but there's room for some improvement there. You do have CPR education as a requirement for graduation and some Good Samaritan laws, but we need to do some work in a particular area with regard to access to care. We need some state laws to help provide an assurance that patients who need a particular medication can get it without jumping through 3,000 hoops to get there. So we need copay accumulator laws, step therapy laws. We need safe medical delivery. So don't know if you're aware or not, but those FedEx and UPS trucks get very hot and your medication is in those vehicles. So we need to make sure that we're keeping our medications at the proper temperature. And you are going to have to start paying attention to this at the State House to ensure that everybody gets safe medications delivered to home. And we can't have what's called non medical switching. So that's a pharmacy making decisions that a doctor should be making for their patients. So we're going to need some help on those pieces of legislation. And we're happy to have conversations on how we can do this in a smart, meaningful way that's not too burdensome on any member of the stakeholders, whether it be the patient, the physician, the pharmacy. We want to try to be logical about our approaches here. And we're going to talk a little bit more in a second about the elements of the Healthy Cardiac Monitoring Act, which we're hoping that Michigan will start to move forward so that we can ensure that all of our children are getting their hearts evaluated during their well child examination. So we can definitely improve your grade in Michigan, and we're happy to be your partner in doing so. So we're going to take a few moments to talk about a story. And this is not a happy story. This is your cautionary tale stories. There are two of them today. And this is a story of a young lady named Jillian Blair, and she's actually from Iowa, but where she lives doesn't matter. Her story could happen anywhere. And unfortunately, it has played out in other states, but her story is very poignant. And her mother shared it with us when we were on Capitol Hill 2 weeks ago, trying to raise awareness at the Capitol on why we need to raise awareness about genetic heart muscle disorders. So let's hear from Amy Blair, Jillian's mom. Just hit the key and it'll take to the next slide.
Thank you. Okay. So on February 15th, 2022, which is 2 years exactly today, my 17-year-old daughter, Jillian, and I, we walked into our family physician's office for her well child check. And while we were there, the doctor put her stethoscope onto Jill's chest, and she turned to me and she said, "When did Jill get this heart murmur?" And so that appointment led to us going to see a pediatric cardiologist in Des Moines. And from there, we had the diagnosis of hypertrophic cardiomyopathy. And those words, severe and obstructed, they were still lingering in the air when we were waking up in Omaha, Nebraska to see specialists 1 week later. She went ahead and did a battering of tests. And then on Thursday, April 21st, 2022, the doctors were able to come back and give us our very last test result, which was her genetic test that she was positive for the MYBPC3 gene, which connects her to HCM. She came home from school that day. We went ahead and made an arrangement to see them on Monday and kind of get a plan of action. She came home an hour and a half later after I hung up the phone with the doctor, and I told her what they discovered. And she said, "Okay, that's about what I expected." She ran up the stairs where she had a sudden cardiac arrest. I was able to get up to the stairs within a minute or two. There was a lady who lived across the street who actually sold AEDs, so I had an AED on her within 2 minutes. But unfortunately, our efforts, the efforts of the EMS and the hospital staff were not successful, and we lost Jillian that day. So Jill was a very funny and outgoing girl. She loved music. She loved Harry Styles. He was her favorite. She loved art. She was really, really bad in algebra, and she wanted to be a designer one day. After Jill's death, it was like an explosion went off, and I started connecting dots within my family. And I talked to lots of families on my members of my paternal side, and I found out that we had a lot of similar heart problems. With the help of Omaha, we were able to get all of my siblings, all of my cousins tested. And when we discovered that I had HCM, half my siblings had HCM, 25% of my cousins had HCM. And from then, many of us have ICDs and have had myectomies. We have also lost them. My brother has died in a surgery that was a valve surgery for an enlarged heart. My nephew has had 2 myectomies. My sister had a sudden cardiac arrest 5 months after my daughter died. And I just say that she died of a broken heart, since we're not ever sure exactly what it was. But my family is actually lucky because of Jillian, because she was our call to action. Because of her, my family has the power of knowledge to be able to fight against an invisible gene. But not all families are that lucky. But there is hope for them. Had there been questions that were in place when I took all of my girls to their well child checks that we were asked each time, so that in 2010, when my nephew had his first myectomy, or in 2015, when my brother had died on the surgical table from his HCM, maybe some of the doctors could have put it together that we needed to do a little bit more investigation. Or when my 91-year-old father, who had HCM, and that's how he went down to, he had a sudden cardiac arrest, but if he had gone into his Medicare first visit and was able to tell them that he had 7 siblings who died, all of cardiac arrests, maybe that would have been a trigger to have them look at us a little bit easier. If we had gotten the treatment earlier, I'm hoping, it would have been hopeful that she could have got diagnosed earlier, which would have led to earlier treatment and maybe would have saved Jill's life. And lastly, I am a nurse in Iowa, and I work at a family practice clinic. It would take me 5 extra seconds of my day to ask these questions to a patient, and that would help save thousands of dollars, millions of dollars, and keep thousands of family intact and whole. I wish it wasn't me standing here, and I wish it wasn't my daughter. I wish it wasn't my family. And I wish it wasn't that I know the heartbreak that people go through. I wake up every day and I live a nightmare. But it is me and it is my family, and it's my wish and my hope. And I wouldn't be standing here and none of you would be hearing my voice if it wasn't for the life of a girl named Jillian Blair, and she had HCM.
That is a cautionary tale if there ever was one. And if we were able to put the pieces of Jillian's puzzle together sooner and gotten to her diagnosis, either after her cousin was diagnosed, after her uncle went for surgery, after there was, whoops, what's happening here again? Something happened there. Sorry. My screen is being weird. There we go. So sorry. We could have found Jillian sooner and gotten to her in time if the Healthy Cardiac Monitoring Act were the law of the land in Iowa at the time, and that we were asking family heart health history questions earlier in her well child examinations. The murmur was a great indicator, and we were able to take action when the murmur was detected, but the family history in and of itself should have led to more surveillance. So how do we change the future so that instead of a memorial tribute to Jillian, we could be talking about how she's thriving in college today, living with her implantable defibrillator and her diagnosis of HCM? We have to change how we're approaching our well child exams and how we're asking family heart health history questions. I'm going to share another story with you about a young man named Derek Armstead. This happened in August of 2020. And Derek passed out one day while playing with his nieces and nephews. They're all little. They're under like 7, 8 years old. So we're not talking about roughhousing with teenagers. We're talking about playing with littles. He passed out. They called the ambulance. They brought him to the emergency room, at which point they said, hey, you probably had some kind of a seizure. Maybe there's something going on with your brain. They never asked him about his family heart health history. Had they done so, they would have found out that his mom passed away before she turned 30 from a heart issue. Did he know exactly what the disease was? No. But a mother who dies before the age of 30 of something with her heart, and then a young man shows up in the emergency room with a syncopal episode, he should have had some basic cardiac workup done. But Derek walked in, or rolled in this case, and he looked like a healthy 29-year-old Black man in America who passed out, and nobody thought to look at his heart. 5 days after his first emergency room visit, he was walking up the stairs with his child in a car seat, walked up the stairs, put this car seat down, and passed out, and actually had a cardiac arrest again 5 days later, and he passed away in front of his fiance and his child. Had they asked family heart health history questions at his first emergency room visit, he could have either still been in the hospital 5 days later, or he should have gotten at least a diagnosis and a referral. But we're asking the questions too late for Derek. And there is a very significant problem when we think about our African American and brown individuals in this country. We are not looking at their hearts close enough. So the HCMA is endeavoring with a project called the All Hearts Collaborative that we want all hearts looked at the same way. This same question should be asked of all of us because we all have the same risks of genetic heart disease. So one of the things that we're going to be doing is working with state legislative bodies to improve the evaluation of individuals through the well child examination, ages 1 to 19, that we're looking at family heart health history. We're going to help develop professional development tools so that physicians know what diseases that they're looking for. And you might say, well, why do we want to put more burden on a doctor and make him take another class? Well, if they went to med school 20 years ago, they may not be aware that some of these genetic disorders are as common as they are. If they went 5 years ago, they may not understand some of the newer treatments that are available and what the referral pathway should be for some of these patients. So back in 2015, the state of New Jersey put most of these components to work, and we created a number of pieces of legislation that improved the student athlete pre-participation screening physical, and we added those same questions on heart health history to the well child examination. And we have been able to show a lot of improvement and a cleaner referral pathway for those patients who are diagnosed. And if you come and watch our program tonight online, excuse me, you will see the story of a New Jersey family where we identified the young man through these elements, and then we were able to identify his father, who is also diagnosed. So we're not just looking for the individual child, we're looking for the families who are at risk. And with some simple questions, we can improve that. Now, we also went to Capitol Hill to talk about the Welcome to Medicare exam, because if we ask the questions in the Welcome to Medicare exam about family heart health history, we can find the grandparents. If we're asking the well child, we can find the grandkids. And in the middle, we will find the middle-aged individuals who are at risk of family heart disease issues. So we're looking for both state level and federal level legislation. So how many lives are we talking about in America? It's 329,000. What are we looking at in Michigan? You're right at that 10 million point, couple more and you'll hit that next milestone. But that means there's 2 million children under 18 that could potentially be diagnosed, and we can open the door to these families to ensure that they get the care that they need. So when we're looking at the number of patients that could be identified, pediatric and adult, you're talking somewhere between 108,000 and 320,000 individuals who could be identified with genetic forms of heart disease. Now, you might be thinking, well, that sounds expensive. It is far more expensive to treat people inappropriately than get them into the right level of care. And if you want to go on the federal level, there is a General Accounting Office report from October of 21 where they looked at the cost of genetic diseases. And many of these are genetic diseases. Some of them are acquired, some of them are congenital, you're born with them, some of them develop later in life. But if you look at the cost of the management of these diseases, a large number of the dollars are going towards mismanagement because they don't know the underlying disease mechanism. And we want to get to precise medicine. We want to make sure that people are being treated for the actual diseases that they have, not things that might look like something else. So we have the opportunity to be more cost effective in our approach here. This is some images from our Capitol Hill Day. And this image down here is one of my favorites of all time. We have Marsha, who's 81 and 3/4, living with HCM, sharing a heart with Jared Butler, who is an NBA player with HCM. You can hear his story tonight. And you can be an NBA player with HCM in 2024. And you can be an 80, almost 82-year-old woman who is a QVC model currently, living with HCM and thriving with HCM. We are not one thing. We do not have HCM tattooed on our forehead. We look like everybody else. And we're relatively healthy individuals, except for our hearts have a genetic mutation and it needs special attention and care so that we can stay here and do the work that we're intended to do and enjoy our lives. So we're hoping that we can not only have HCM resolutions, HCM Day resolutions, and thank you, Michigan, for providing one. This gives us an opportunity to have a day to just really talk to you about what HCM is and what we can all do to make the world better for those with HCM and other forms of genetic heart disease. We also want to make sure that these laws are in place and that they are managed well and that they're not burdensome. We want them to be logical. So we really appreciate the state of Michigan for having HCM Awareness Day. And if you or a member of your office wants to talk to us more specifically about what we can do in the state of Michigan to help make sure that families stay whole and hearts are cared for, you can scan this QR code, you can set an appointment at your convenience, and we can start having a conversation. You can also email us at 4hcm.org. And we want to just give a moment to thank our board of directors, our staff, our volunteers, our partners, our sponsors, and all of our HCMA Recognized Center of Excellence partners specifically, because it does take a village to not only identify, but treat these people and patients and families so that we can make sure that everybody's living their best lives. We're happy to take any questions at this time. And I do see one question coming in that looks like it might be written I don't know what language that is. So you're going to have to write that in English because I don't know what that is. So David, what do you think we should do in Michigan? How are we doing?
There we go. Just unmuted myself. Yeah, I think well, we collaborate. We're good friends with our clinical partners over on the east side. Dr. Saberi, who has a great program, and so I think we've really invested a lot over the years in seeing patients and trying to get trying to diagnose patients and get their families into our clinics. But that's kind of as you were alluding to, that's kind of on the back end. Usually we see patients after something has happened, and we want to identify, as you said, obviously. Kids tend to have a lot more touch points with the healthcare system, and obviously they have hopefully the most years ahead of them, to benefit from being diagnosed early with a heart condition. So yeah, I really support your Healthy Hearts initiatives, and really trying to really trying to improve and kind of standardize screening for for children for potential heart diseases and family history. I definitely think that that is a priority, kind of on the front end of identifying identifying patients with possible heart diseases. And then on the other end, we've talked a lot about access to treatments. There's going to be a lot more, new treatments coming out for HCM, and we've seen, obviously, with any new medication, especially if it's a first ever in its class, it tends to be a challenge to who's going to pay for that, who's going to approve it, and uh, and we've seen some significant challenges with that. And having had patients for years who have gone through and volunteered of themselves to go through research studies before we knew whether these medications were safe or effective. I really advocate for patients to be able, especially those patients who have gone through this on their behalf, to get these medications approved. I think we have to do as much as we can to make these treatments available, um, to the appropriate patients, because some of these medications, I mean, sometimes they can help patients avoid having to have an open heart surgery, um, and really really improve quality of life, get people back to work, get people back to their families. And so those are the kind of practical realities of the access to treatment that really kind of motivates us to want to do better for our
I will take I will take an opportunity here to say, in the state of Michigan, we are having problems with a payer system that has been reticent to allow access to the first labeled indication drug for hypertrophic cardiomyopathy. Its chemical name is mavacamten. Its name brand is Camzyos, but there will be others coming down the pike. We have the second in class coming hopefully within the year, and then there's going to be more. But we do all this work to develop these new medications, not because we want to have expensive treatments, and new is expensive because development of these drugs is not inexpensive, but they're treating the actual mechanism of the disease. We used to use things like beta blockers and calcium channel blockers and drugs that were made for other diseases and other types of heart disease, but now we have targeted. And if we can use those targeted meds, we keep people feeling well. We get them to be able to live their normal lives, which means go to work, take care of their families, do the things that they want to do, but we need access. And if a couple payer systems are like, no, we don't believe in that, well, we believe in it. We believe in these new therapies. We know that they're important to ensuring that people can stay healthy and stay actively engaged in their chosen professions for whatever period of time that they want. So we want to put the control back in the hands of the physician and the patient to determine what care is best for them, and help ensure that our state legislative bodies are supporting that doctor-patient relationship and not allowing somebody else or another entity to interfere in that. So, Michigan, we need your help.
Well said.
Okay. Okay. Well, I thank you all for joining us for the 5th legislative briefing of HCM Awareness Day. If you are an HCM family, a clinician, a member of industry, a member of the legislative body that want to learn more about the work of the HCMA, we will dive down those corridors later this evening, 6:30 Eastern Time. Join us right here online for a webinar where we will talk about all things HCM and all things HCMA and how you all can get involved with our efforts. Thank you so much. David, thank you for joining us. As always, thanks to the entire team at Corewell, and we look forward to doing lots of great things in Michigan.
Thanks, Lisa.
Thank you.